I'm a radiographic technologist. I assist the radiologist in determining a diagnosis by performing a quality radiographic examination, or an X-ray. There are many facets to this, which include excellent patient care and communication skills, providing a thorough and accurate history as to why the exam is being performed, and proper positioning, technique, and radiation protection for the patient. Once we've obtained the image, it's sent to the radiologist so that he can interpret it.
Medical assistants are multi-skilled allied healthcare professionals who perform a wide range of roles in physicians' offices, clinics, immediate cares, insurance agencies, and a variety of specialties. They are cross-trained and proficient in a multitude of administrative and clinical duties. Their versatility makes them employable and are viewed as important members of the healthcare delivery team.
A physical therapist assistant is part of a team working under the supervision and direction of a physical therapist. Once the physical therapist evaluates and creates a treatment plan for the patient or client, the physical therapist assistant will provide select components of that treatment. The physical therapy interventions that we can provide include therapeutic exercise, stretching, and functional activities. They can also include modalities such as heat, hydrotherapy, or electric therapy. The physical therapist assistant may also modify the treatment plan to progress the patient based on the physical therapist's direction, or when it's a patient's need for safety to modify. Physical therapy assistants also document and record the therapeutic intervention and the patient's response to that.
The role of the professional nurse is multifaceted in providing compassionate care to the patient to promote optimal health and to also prevent further disease and injury. The nurse can collaborate with doctors. They can also supervise other personnel such as licensed practical nurses and nurses' assistants. The nurse works in hospital settings. They may work in a home care setting. They may also work in clinics and urgent care settings. The nurse's role is never ending, and the nurse is expected to continue education and participate in research to optimize the health of the community.
Some of the responsibilities of a registered professional nurse are performing physical assessments and health histories, providing health promotion, counseling, and education, administering medication, providing wound care, and numerous other personalized interventions and treatments, interpret patient information, and make critical decisions about needed actions, coordinate care in collaboration with other healthcare professionals, direct and supervise care delivered by other healthcare personnel such as LPNs and nurses' aides, conduct and research to improve patient outcomes.
I'm going to move this out of the way.
Okay.
We're going to do a couple more exercises here. Just going to bring the chair over.
All right, Kathy.
Okay. Let me grab this towel. We're going to need that. Okay. The next exercise I'm going to have you do is you're just going to scoot forward in your chair for me.
Okay.
So yeah, coming forward. I'm going to put a towel underneath your foot here.
All right.
If you could just lift up a little bit, and there we go. So on this exercise, you're going to take your foot, you're going to bring it back as far as you can until you feel a stretch, no pain. You're going to hold that for, let's try for 10 seconds first, okay?
Okay.
So go ahead and bring it straight back. As soon as it feels tight right there, hold it. Good, and then come on forward. We're going to do that 9 more times for a total of 10, okay?
Okay.
And each time I want you to try to get back a little bit further. We
All
really
right.
want to increase the range of motion in that knee, okay?
Okay.
How's the knee been feeling?
Pretty good.
Good.
A little
Okay.
bit tight where the staples are, but
Okay.
not bad.
Good.
Getting better every day.
And I seen you're walking much better. That's looking good. It's
Yeah.
coming along.
Yeah.
Hopefully soon you'll be off the walker.
I'm trying to get back to spinning class. You know, I love my spinning class at the BAC, so.
Oh, that would be perfect. Good. And then we're just gonna watch your knee here. I don't want you cheating here. We gotta keep
Okay.
that leg in good alignment here. Good. And sit up nice and tall for me.
Okay.
There you go.
Every day it seems to be a little bit better.
Good. Our goal is to get you back to that 130 degrees of knee flexion.
Okay.
That's ideal. Good. Are you counting?
Yeah, I think this one is 10.
Good. Well, let's do one more. And this last one, I'm just going to add a little bit of overpressure, get a nice good stretch in here. Good, and we're just going to hold that. 2, 3, 4. Nice, and then come on up.
Okay.
Good. And now I'm going to have you lift your leg up and we'll move this out of the way.
All right.
Good. Okay. Our last exercise we have today, I'm going to have you standing. Let me move the chair out of the way. There we go. And I will show you first. Go ahead and just sit and rest for just a second.
All right.
Standing here, you're going to bring both hands on the table, standing up nice and tall. You're going to try to bring that left knee up, trying to bring that heel towards your bum. But keeping that leg straight, okay? So keeping that leg down as you're lifting up like that, okay? I don't want you to swing it forward or push it back.
All right.
Okay?
I'm going to give it a
So
try.
come on up. Good. I know it's a little sore. Try to put some more weight through that leg.
Okay.
There you go. Good. So keeping the knee down here. Now try to bring that heel up towards your bum as high as you can. Good. And then slowly lower back down. We're going to do 10 of these. Then you're going to take a little rest break.
Okay.
We're going to do a set of 3. Good. Good. Standing nice and tall. I hear you have a little rattle as you're sitting here. Has everything been going okay?
I've been
You
coughing a
coughing too?
little bit, and it feels like stuff is rolling around in my chest a little bit. Yeah.
Okay.
Yeah. There's a
Come on.
lot of stuff going around this time of the year, though. You know, I'm sure it's just something like that.
Oh, yes. Good. Then just watch that you're keeping that knee straight down.
Okay.
There we go. Good. And then good posture, too. That's really important. How's that leg feeling?
It's getting tired. Getting a little sore.
Any increase in pain?
No, just kind of tight where the staples
Those
are, but
Okay, good. One
Right.
last one,
okay.
and then I'll have you rest for a minute.
Okay.
Oh.
Come on in. I think that's probably my nurse, Mel. I was expecting her.
Oh, good.
Hi, Babs. How are you doing?
Good. How are you, Mel?
Good. I'm Melissa. I'm Babs' nurse today.
I'm Kathy. I'm the physical therapy
Nice to
assistant.
meet you.
Nice
How's
to
she
meet you.
doing?
She's having, she's doing really well with therapy. The exercises are coming along.
Okay. Well, I'll let you guys finish. I'm just going to set up over here.
Okay. Go ahead. One more set of 10 here.
Okay.
Good. Nice and tall for me. Make sure
I
you're
know. I do
breathing.
have a tendency to lean over there.
Yeah. Good. Try to get up a little bit higher. I know this last set is the
Yeah,
hardest
no,
one.
It's getting tired.
And one last one here. Good. Go ahead and have a seat for me.
Okay.
Good. All right, nice job today.
Okay.
You did a great
Thanks a
job.
lot,
Keep up the good
Kathy.
work.
Okay.
And I'll see you in a couple days, okay?
All right. Thanks
good
so
working with
much.
you.
Have a good
Welcome.
rest of your day.
Thank you, you too.
Hi.
Hi. So as I was working with Babs, I noticed that she was having a little bit of like a rail sound, and she said she's been coughing, and she had a little bit of sputum. If you could check that out for me.
All right. I'll definitely look into it.
Okay, thank you. Oh, now I'll move out of your way here.
Hi, Babs. How's your knee feeling, Babs?
It's feeling pretty good, Mel.
Are you having any pain where the staples are or anything?
No. I took the dressing off earlier
Okay.
when I was getting washed up because I knew you'd be putting a new one on.
Yep. So I'm going to put a new one on. It looks really good, though. I don't see any drainage or redness that's abnormal. So that's a good sign.
All right. I can't wait to get the staples out. That'll be next week.
Yeah, that's exciting. How was PT today?
It was good. It was good. I'm getting better every day.
Good. That's good news.
Trying to get back to spinning class, you know, so
Oh,
that's my
yes.
goal.
I know you love spinning.
I do.
All right. You want to help me and hold that right
Sure.
there? Thank you.
What do you think? You think it looks good?
I do. I think it looks really good. It looks like it's healing well. So make sure if you see any drainage or blood or anything on this, you call your doctor, okay?
Okay. I haven't seen anything like that. It's been nice and dry.
Okay. So anything new, give him a call.
All right.
And then your physical therapist said you were coughing a lot and you had some mucus coming up.
Yeah, I got this this green
Okay.
mucus here. Yeah, that started yesterday.
Okay.
You know, it just kind of feels like stuff's rattling around,
Mhm.
and I was bringing off that green stuff. Looks good, thank you.
Are you having any like chest pain or anything?
No, I feel like I get a little bit winded when I'm walking with my walker across the room.
Okay.
But other than that,
So your breathing's okay when you're resting?
yes.
Okay. So I'm just gonna grab some vitals on you.
Okay.
Okay. So you do have a little bit of a temperature. I'll make
Okay.
sure to report that to your doctor.
All right.
Have you put this on your finger?
Okay.
Okay, thank you.
How's the weather out there today?
It's chilly.
Glad I don't have to go out.
Yes. It's definitely gonna start snowing soon.
I'm not ready for that.
Me neither. Which arm's better for your blood pressure? More
This arm,
comfortable?
if you don't mind.
Then you can leave it resting on the table.
Okay.
Okay. Have you been drinking a lot of fluid since you've been home?
Coffee. Coffee with the neighbors. They came over to see me, and then my girlfriends brought me some soup, and we had a little more coffee.
Okay. What about water? Any water?
Just a sip with my pain pill when I take it.
Okay, so water is really important. So that keeps your lungs clear and everything. So make sure you always drink a lot of water. Even if you're not sick or anything, water's always good.
Okay. I probably should drink a little more water.
Yeah. So I'm going to take your pulse.
All right.
Does it hurt when you cough?
Oh, it's starting to get sore in my rib areas. I think,
Okay.
especially at night. I was coughing a lot last night.
Okay.
So, yeah.
All right, so I'm going to have you scooch up if you can, and I'm going to listen to your lungs from the back.
Okay.
Just going to lift your sweater up.
Okay.
Take a deep breath in. Deep breath in. And out.
It's kind of hard to do that.
One more time. Deep breath in and out. Okay. So I do hear some sounds that are concerning, but I'm going to want to call your doctor before I tell you anything.
Okay.
Have you been using your incentive spirometer that came home with you from the hospital?
That's a little apparatus I had to breathe in
Yep.
at the hospital. I kind of left that in the garbage can in my hospital room before.
Oh, okay.
I didn't really like that thing much.
No, were you
No.
using it in the hospital?
When they told me to, when they were right there, but they told me to use it during the commercials, but I was so tired. I was sleeping
Yeah.
during the commercials. I didn't have time to use that.
Okay. So I'm going to give your doctor a call and report all this to him, and I'll let you know what he says, okay?
Okay. I probably should use that breathing machine more, huh?
Yes, it definitely helps. Hi, Dr. McDreamy. This is Melissa. How are you? Good. I'm with Babette Strasberg. Yep, she had a total knee replacement 1 week ago. She's having no other significant medical history. Her vitals today were a temp of 101, pulse 80, respirations 18, BP 120/80, and pulse ox 88% on room air. Yes. Yeah, she did state that yesterday she started having like a productive cough and producing moderate amounts of green thick sputum. Yep, I did a lung assessment and rhonchi was heard in all the lung fields upon auscultation. Okay. Okay. I'll let her know. Thank you. Bye-bye. So I know this might be hard for you, but he does want you to go to the emergency room.
Oh.
He thinks you're forming some complications in your lungs. So, but hopefully we can get you in there, figure out what's wrong, and bring you back home.
Oh, it's so disappointing. Do you really think it's necessary?
I do. So your lungs didn't sound clear, and I know you're having pain, which is never good when you're breathing. So I think it'd be a good idea to go there, get checked out, and see what's going on.
Hi, how are you today?
Well, I've been better. My doctor wanted me to come in. I was here about a week ago for a knee replacement, and the home care nurse came to see me this morning and thought I was maybe developing a complication. I have a bad cough.
Okay, yeah, we'll definitely want to get you checked out. Can I have your name so I can input it in the computer?
Sure, Babette Strasberg.
And how do you spell the last name?
STRASSBURG.
Okay. And your date of birth?
10/29/1988.
Okay. And can I have your address?
Sure, it's 32 Sunshine Drive, and that's in Grand Island.
Okay. And the zip?
14072.
Okay. And do you have your photo ID and insurance card on you?
Oh, sure do. Let me get that for you. All right, here you go. Picture ID and my insurance card.
Okay. I'll get those scanned in the computer. All right. Looks good.
Okay.
All right. I'm just going to have you have a seat in the waiting room. I'll call someone from the floor to come get you with a wheelchair, okay?
Okay. All right, thank you so
You're
much.
welcome. I hope you feel better.
Thank you.
Good morning, Mrs. Strasberg. What brings you in today?
I had a knee replacement here about a week ago, and then I went home. But I developed a cough and was coughing up some sputum. So the home care nurse called the doctor, and he said it would be best for me to come back to the hospital to get that checked out.
Okay. Does it sputum? Can you describe that to me?
Yeah, it's like thick and greenish,
Okay.
and I have quite a cough too.
Okay. When you cough, is it when you take a nice deep breath?
When I take a nice deep breath, and especially when I was laying down last night, coughing all night, I hardly got any rest.
Okay. Did they send you home with an incentive spirometer when you had your surgery done on your knee?
Oh, is that breathy machine with the tube that I was supposed to breathe into?
Yeah, we like to have that to kind of mobilize those secretions and get those going. Sometimes people develop secretions from just being in bed a lot.
Oh, I didn't like that thing so much, so I kind of left it in my garbage can in the hospital room and went home without it.
Okay, yeah, we kind of want to make sure we keep that with you. Okay, that's going to mobilize those secretions because what's going on now might be a complication, like you said, from the surgery.
Okay.
Okay. I'm going to do a little assessment here. Do you mind having your legs drape over the side of the bed?
Sure.
Okay, I'll help you out here.
Okay. I got it. It's just this knee moves a little bit
Okay.
slow.
Okay.
How's that?
Good.
All right.
Now, I'm going to have my hands on your back here, and as I lower my hands, each time I lower my hands and place them on your back, I'd like to have you say 99 for me.
Okay.
Okay? Go ahead.
99.
99, 99, 99.
Okay. I'm going to have you take a nice deep breath for me. Okay. Is that cough that you say you've been having? Okay.
Yeah, that's it.
When you take the nice deep breath, you begin to cough?
Yeah.
Okay. Now I'm going to have my hand on your back and I'm going to tap my finger, okay?
Okay.
Mrs. Strasberg, I'm hearing a little dullness in your lower right lobe of your lung. So I'm going to auscultate and I'm going to listen to your lungs a little bit here and develop a plan here for you, okay?
Okay, whatever you need to do, Chris.
Okay.
I'm pretty easy.
Okay. So I'm going to have my stethoscope on your back, and each time I place my stethoscope on your back, I'd like you to take a nice deep breath for me.
All right, I'll do that.
Go ahead for me. Okay, Mrs. Strasberg, I'm hearing a little gurgling in that same part of your lung, in the lower right lung, okay?
Oh,
So what I'm going to do is I'm going to get with the radiology department, and we'd like to do a portable chest x-ray so I can let the doctor know what's going on, and then we'll go from there.
Okay.
We'll develop a plan. We'll get you better in no time.
All right, that would be great.
I'd also like to get you another incentive spirometer. This way we can get those secretions mobilized, and then we'll get you on your way. I know you like to do spinning, right?
Yeah, I can't wait to get back to spinning class, so I guess I'll use that incentive spirometer if it'll get me back to spinning class.
Yeah.
I guess I probably should have used it the first time and taken it
Sure.
home with me. All right. Thanks so much, Chris.
Not a problem. And that'll also help with your healing of your knee, too, because we'd like to get you back to physical therapy. Okay?
Okay. All right,
All
great.
right.
Thanks so much.
Not a problem. I'll be back in a little while.
Okay, sounds good.
Hello, radiology. This is Chris down in the ER. I'm taking care of a Babette Strasberg in room number 2. I have some concerns, and I'd like to get a portable chest x-ray if we can. Yes, in room number 2. Thank you.
Hello, Ms. Strasberg. I'm Chad. I'm here to take an x-ray for you today.
Okay, hi, Chad.
Can you just confirm your first name for me?
Sure, Babette,
And your date of birth.
10/29/1988.
Okay, your wristband there. All right, and just for radiologic purposes, because we are using radiation, there's no chance of pregnancy at this time at all?
No.
Okay, then I'm going to have you sign off on our sheet here for you.
Okay, I'm signing my consent here.
Mhm.
Okay.
I understand you're having some problems breathing today in your chest area. Can you tell me what's going on there?
Yeah, I was, I had a knee replacement here a week ago, and I went home, but then at home yesterday, I started coughing, and I was coughing up some green stuff.
Some green phlegm.
Yeah.
Okay, and this started yesterday?
Yeah.
Okay. Are you a smoker at all?
No, never
Okay.
smoked a day in my life.
All right. And do you have any history of asthma or any other breathing issues?
No.
And no chest surgery at any time?
No?
All right, we're going to get you sitting up straight in the bed then for an x-ray.
Okay.
I'm just going to need to take your pillow out from behind you.
All right.
I'm going to bring your bed up a bit.
All right.
All right. You can just relax there.
Okay.
And now if you just sit forward, I'm just going to slide this tube here behind you. You can go ahead and slide back against it.
All right.
All right, and when I give you a prompt, I'm just going to have you taking a breath as best you can and just hold it for me. So just hang on a second while I do that.
Okay.
And then we'll put your shield here for you for protection.
All right.
All right. Okay, just one moment. I'm going to go ahead and focus the tube for you.
All right.
All right. All right, and go in and take a deep breath in for me. And hold it. And you can go ahead and breathe again.
Okay.
And we'll get this right out to the doctor to take a look at. Let me get this out from behind you here. All right, take that.
Okay.
Get your pillow back behind you. Would you like your bed moved back down for you a little
Yes,
bit?
please.
Sure. Go ahead and move it back down. How's that for you?
All right. Good.
All right,
Thanks
great.
a lot, Chad.
No problem. I hope you have a great day.
All right. Thank you. You too.
Well, Mrs. Strasberg, I talked to the doctor. He also looked at your results as far as your chest x-ray went. So he wants you to keep you here for a couple days, and we're going to give you some IV antibiotics.
Okay.
Okay, and just to kind of get rid of that infection that you have going on.
All right.
Okay.
I'll do anything to get back to spinning, so if
Sure.
that'll help me.
Yeah,
I
and
can
then
do
I'm
it.
sure you've seen this device before.
I know what that thing is, Chris.
Okay, let's make sure we use this properly this time, okay? And then we'll make sure we
Okay.
get sent home with this, okay?
All right.
So what I want you to do, again, is to take a nice deep breath and let it out. And then I want you to take a nice deep breath after having your mouth on this mouthpiece here.
Okay.
And then what we're going to do is try and keep that yellow mechanism in there up.
All right.
Each time you take a nice deep breath and use this, you should be able to get higher and higher.
Okay.
I want you to do this 10 times an hour, okay?
Okay.
So maybe even just do it during the commercials on the television.
All right. I won't leave it in the garbage can this
No,
time.
let's just make sure
Probably
you
wasn't
get
a
that.
good idea.
Yeah.
All right.
Make sure that goes home with you.
Okay, I'll definitely take it home this time. And Melissa, the home care nurse, said that I probably should drink more water as well. So I'll definitely be working with the incentives barometer and drinking more water as well this time.
Absolutely. Let's make sure you drink plenty of water to kind of get those secretions thinner, okay?
Okay. All right. Thanks so much,
Not a
Chris.
problem.
All right.